Introduction. Welcome, students, to today's lecture on the topic of pancreatic pseudocysts. In this comprehensive session, we will delve into the various aspects of this condition, including its introduction, complications and differential diagnosis, treatment options, acute versus chronic presentations, imaging modalities and techniques, pseudocyst drainage techniques, management of infected pseudocysts, complications associated with pancreatic pseudocysts, pediatric cases, endoscopic ultrasound-guided interventions, novel treatment strategies, and the impact on quality of life and patient education. So, let's begin our exploration of this intriguing subject. Pancreatic pseudocysts are fluid collections that form around the pancreas due to injury or inflammation. They are not true cysts and can be caused by pancreatitis, trauma, or other factors. Pseudocysts can vary in size and location, sometimes extending into nearby organs. Pancreatic pseudocysts can cause a variety of complications, including infection, rupture, hemorrhage, biliary obstruction, fistula formation, and compression of adjacent structures. The clinical presentation can be nonspecific, with symptoms such as abdominal pain, bloating, nausea, and vomiting. Differential diagnosis of pancreatic pseudocysts includes true cystic lesions of the pancreas, such as neoplastic cysts, mucinous cystic neoplasms or serous cystadenomas, as well as other fluid collections, such as abscesses or hematoma. The management of pancreatic pseudocysts depends on several factors, including the size, location, duration, symptoms, and presence of complications. Treatment options range from conservative management with close observation to invasive interventions. Conservative management involves supportive care, pain control, and close monitoring of the pseudocyst size and symptoms. Interventional approaches include endoscopic, percutaneous, or surgical drainage, depending on the cyst characteristics and patient factors. Acute and chronic pancreatitis can both lead to the formation of pancreatic pseudocysts, yet there are some key differences between the two conditions. Acute pseudocysts often occur as a consequence of an episode of acute pancreatitis, typically resolving spontaneously within a few weeks. In contrast, chronic pseudocysts develop in the setting of chronic pancreatitis and tend to be more persistent. The management approach may vary depending on the underlying etiology and duration of the pseudocyst. Accurate imaging plays a vital role in the diagnosis and characterization of pancreatic pseudocysts. Various imaging modalities, including ultrasound, computed tomography, CT, magnetic resonance imaging, MRI, and endoscopic retrograde cholangiopancreatography, ERCP, can provide valuable information about the size, location, and internal characteristics of the pseudocyst. Each modality has its strengths and limitations, and the choice of imaging technique depends on the specific clinical scenario. When intervention is necessary, various drainage techniques can be employed to alleviate symptoms and prevent complications. Endoscopic drainage, performed using endoscopic ultrasound, EUS, guidance and stent placement, is considered the first-line approach for many pseudocysts. Percutaneous drainage, performed under radiologic guidance, is another option, particularly for larger or complex cysts. Additionally, surgical drainage may be required in selected cases where endoscopic or percutaneous approaches are not feasible or have failed. Infection of pancreatic pseudocysts represents a significant complication that requires prompt intervention. Infected pseudocysts are associated with systemic inflammatory response syndrome, SIRS, sepsis, and organ dysfunction, necessitating a multidisciplinary approach involving gastroenterologists, interventional radiologists, and surgeons. Treatment involves a combination of broad-spectrum antibiotics, percutaneous or endoscopic drainage of the infected collection, and source control measures. Pancreatic pseudocysts can lead to an array of complications that significantly impact patient outcomes. These complications include cyst rupture with peritonitis, gastrointestinal bleeding, biliary obstruction, pancreatico-pleural fistula, pancreatic ascites, pseudoaneurysm formation, and secondary infection. Timely recognition and appropriate management of these complications are essential to minimize morbidity and mortality. Although relatively rare, pancreatic pseudocysts can also affect the pediatric population. In children, pancreatic pseudocysts are most commonly associated with trauma, pancreatitis, or congenital pancreatic anomalies. The management of pediatric pseudocysts requires special considerations due to anatomical differences, the potential for growth disturbance, and the impact on overall development. Interventional approaches may include endoscopic, percutaneous, or surgical interventions, tailored to the individual patient's needs. Endoscopic ultrasound, EUS, has emerged as a valuable tool in both the diagnosis and management of pancreatic pseudocysts. Use allows for accurate visualization of the pseudocyst, guidance of therapeutic interventions such as cyst drainage or pseudocyst necrosectomy, and assessment of treatment response. Use-guided techniques have revolutionized the field, providing minimally invasive alternatives to surgical interventions and enabling improved outcomes for patients. Research and advancements in the field of pancreatic pseudocysts continue to explore novel treatment strategies aimed at improving patient outcomes. These include the use of endoscopic techniques such as endoscopic necrosectomy, pseudocyst ablation with alcohol or fibrin glue, and the development of new endoscopic devices and stenting materials to enhance drainage efficacy. Additionally, various medical therapies and minimally invasive surgical techniques are being investigated to optimize treatment approaches. Living with a pancreatic pseudocyst can significantly impact a patient's quality of life. The symptoms, complications, and management of this condition may lead to physical and emotional distress. As healthcare providers, it is crucial to educate patients about the disease process, treatment options, potential complications, and lifestyle modifications. Patient education plays a vital role in enhancing adherence to treatment plans, managing expectations, and improving overall well-being. Pancreatic pseudocysts are challenging to diagnose and manage. It's important to understand the causes, complications, diagnosis, and treatments in order to provide the best care. Using imaging, drainage techniques, and endoscopic interventions can prevent complications and improve outcomes. Ongoing research aims to find innovative solutions.